Hi, Nursing 101 students and future Nursing 101 students. This is Jack. I am a student nurse and I survived Nursing 101, the fundamentals of nursing. And I just wanted to give you guys a few tips on how to survive, specifically when you're dealing with the Taylor book. Taylor's Fundamental of Nursing, 9th edition, the art and science of personal nursing care. Just going to give you a couple of tips because there's some things that you don't really realize when you're going into nursing school that oh my gosh, I wish someone would have told me. When I first started, I thought, okay, we're going to read this book and we're going to go from the beginning to the end. Oh no, that is not how it works. Okay, if you open up the book, you will realize that the skills are in the back of the book. And by the way, you're going to need to know just about all of those by week 5. So it moves very, very quickly. My advice to all of you, whether you are an aspiring student who wants to go into nursing, go ahead and get a book now and learn the skills. And then, when they give you the new edition, you can just upgrade from there, learn whatever's new in the new edition, but go ahead and learn the basics now. The basics are probably not going to change too much. Some might, some probably won't though. Okay, so there's a few tips that I have. So one of the things that I found very helpful, and it's kind of funny because you think this stuff would be obvious because people are like, well, if you just read, then you'd know. And you're like, okay, but I read and I didn't know. And I don't know how I didn't know because I certainly read a lot. So, and this book is huge. I don't know if you've noticed, but it's like, 2,000 pages. So good grief, right? Anyways, one of the very key things that I wanted to bring up to you guys from the very beginning that I found very life-changing and life-saving, specifically when it comes to surviving and learning how to do things. Let me find something that's reasonable. Okay, let's talk about this. When you get into the skills, I don't know how much I can show you, so I better behave myself. But when you go into the skills at the very beginning, I'll just give you like a quick peek. You'll see them. Woo! They're like in yellow pages, okay? Real quick peek. So if you turn to the skills, they have delegation considerations. They let you know who is allowed to do what. That's actually kind of important to know. So you need to know if a CNA is allowed to do it. You need to know if an LVN is allowed to do it, or if it's just you. Okay? That's important to know. And by the way, your teachers aren't going to tell you all this. And it kind of stinks. You got to do a lot of studying on your own. It's not like a lecture-based kind of thing. If you want to survive Nursing 101 and you want to like thrive and you want to like get a solid A in that class and really know what you're doing and build a very strong foundation for MedSurg 1, you are absolutely going to want to start now because it moves very, very quickly. There's just not enough time. Anyways, the very next thing that I wish somebody would have told me, I read and somehow I didn't see it, is it lists equipment. Well, here's something that nobody really explains that I think is really important, and I want to tell you guys right now. In order to pass Nursing 101, you have to do the clinicals, but you have to do what's called checkoffs. You have to be able to perform the actual activities that are required of a nurse, okay? Well, not all of them, but a lot of them, okay? You'll see in that book there's a whole big list of skills. So anyways, what they don't really tell you and you don't really register is you're gonna have to go into that back room, and just like if it were a hospital, all by yourself, and you're gonna have to be able to locate those items. I'm talking little items, random things that you just wouldn't think you need to grab. Okay, and it is really important to start memorizing that and getting that concept in your mind from the very beginning. Before you even start school, before you even learn your first thing, you need to know that. It'll save you a lot of time. When you start practicing from day one going into that back room, pay absolute close attention to that. Okay, so for example, nasogastric tubes. Okay, If you were like me going in to nursing 101, you're like, oh yeah, okay, the tube probably comes all together, no problem, right? Oh, no. You know, you have to go find the Lopez valve. You got to get the tube. Then you got to go actually find the valve that connects to the tube. Okay, so you got to know what it looks like. You got to know what it is. You got to know what it does. You got to know where it goes. By the way, you also need to remember to get your safety pin and your rubber band, or if they're allergic to latex, make sure you check those allergies. You're going to need to make sure that you get tape. And if they're allergic to specific tapes, you better make sure you get the paper tape so that you can connect that tube to the gown. I'm not joking. I mean, is it like every day that you actually have to really think about before entering a room that you actually have to remember to go get a rubber band? No, it's not like a common thought. Normally we think, oh, we'll just delegate that to someone else, but that's not exactly how it works. Because what if you're in a circumstance where you actually have somebody who has precautions, like droplet precaution or an airborne precaution? You can't just walk out the room and just go grab whatever, okay? Or say you have medications out. You can't just walk out the room and just go do whatever. You can't do that. So it's very important that you have all of your supplies together. Some of the ones that are easy to forget might be like a bath blanket. That's pretty much needed for almost everything. You're going to want to cover people and give them their privacy, things like that. Basins are a great way. I forgot what they're called. Great. I'm going to have to go back and look at my own nursing 101 book. But you know, those like water tub basins, you can use them for bath basins. You can put a lot of supplies in there. So, you know, tape is a common one that's forgotten. Again, check allergies. Some people are allergic to paper tape. I mean, not paper tape, but plastic tape. So make sure that you're using paper tape if that's the case. Make sure you gather all of your supplies, especially if you're going into a sterile environment. Oh, God, please grab extra supplies for the sterile environment. Extra gloves. Always grab extra gloves, extra supplies, because trust me, it is really easy to accidentally bump something with that glove. And then you're going to fail your practicum or anything else that you do that you're getting tested on. So you want to make sure that you have all the supplies you need, extras if necessary. Know what you're doing, know why you're doing it, and prepare for anything. And you need to know all the supplies, and you need to know what goes into all those supplies. So know that equipment list. Oh my God, know it. Because you got to be able to organize it, get it together, and get it to that patient's room. When you think about it, I know this sounds really overwhelming, and trust me, I thought I was going to croak when I figured that out, because I didn't realize how many parts there were and how scattered about they were. I mean, that was a little intense. I'm like, this is not my forte. Okay, maybe figuring out what's wrong with you is my forte, but finding, you know, the Lopez valve and finding that you know, tube over there and finding where on earth are the rubber bands, that was not something I was comfortable with. It took me a while. So get in there and rummage around and learn where things are. Do not be afraid to get your hands on it. Touch everything. Do it for yourself. Don't just watch. Because I'm going to tell you right now, I'm a credentialed teacher. I can't even say that out loud. That's sad, but that's true. But the reality is, I can correct people all day long and tell them what they're doing wrong, but if you think that I can go and do it right, nope. Nope. I do a lot of things wrong, okay? A lot of things wrong, because you know what I have to do? I have to practice over and over and over and over again. I have to get my hands on it over and over and over and over again. And you will too. And the more that you do it, the better you'll become. Is it going to feel awkward? Yeah. Shoving a tube up a mannequin's nose is going to feel a little bit weird. Talking to a mannequin and knocking on a door is going to feel a little bit weird. Having to take people's blood pressure, and it's going to feel a little bit weird. You know, we all like our 18 inches of space at minimum. Okay, that's just simple psychology. I understand your pain, but you can do it. But I just want you to understand, just make sure that when you're looking at the skills, and the skills are towards the last half of the book, in the back of the book. In fact, in Taylor edition 9, let me be explicitly clear. If you just open to the back of the hardback, it's literally on the actual hardback. It's attached to it. It says list of nursing skills. It starts at skill-24.1 and it goes to skill 40-5. Holy macaroni. That's a lot of skills to learn in 5 weeks. My advice to you, don't wait till nursing school starts. My advice to you, learn them long before nursing school starts. Because let me be very clear about what's going to happen when you get into nursing school. If yours is anything like mine, you have a quiz on the syllabus day 1. And you're going to have a quiz on 160 plus acronyms or more on day 2. Okay, I'm a smart person, but even that's a little bit much for me. So you'll find that out during orientation, or maybe your school does things a little bit differently, but our school kind of started before the semester started, and that's just the way that the ball bounced. And if you're watching this video, you're probably going to my school. So I'm letting you know now, know your stuff, know your acronyms, and don't just know them, know how to spell them correctly. That's not even just important as far as, I know that sounds really kind of like an anal retentive thing, but it's actually not. It's actually really important, especially for legal purposes. When you finally, let's hope you never get there, but if, let's say if, let's not get to when, if there ever is some reason that there is a lawsuit, you do not want to look like you don't know how to spell in your documentation. That is going to make you look a little bit impeachable and potentially negligent when you hit that stand. Okay, so you want to make sure that you can spell. That's why the teachers ask you to spell them correctly, including this horrifically large acronyms. And boy, they pick them and they are big. Again, 165, that's a lot. You want to know my secret advice on that? This is what I did, and this is what worked for me. This actually got me through a couple classes. As far as studying goes, if you are a visual learner and you need to know what things mean before you can actually understand them, which I would honestly advise that you do, when you get a list of acronyms that you need to know and the words that they equate to, look them up, download a picture of what it is, get yourself a cartoon Twitter account. Okay, I'm not joking. One that's just for you. You don't have to share it with any of your friends. It's a study guide. It's a study tool, okay? Put the information in your own words so that you learn what that is, you know? Electrocardiogram, okay. EKG/ECG, whichever one they're going to use at that time. No, both. Anyways, you've got that, right? Okay, what is it? Describe it. Put a picture. So then, once you've got a whole list of 165 of these, you can scroll and you can look at the pictures and you can look at the stuff that you've taken the time to write out in your own words. And you go, oh yeah, I remember that. Oh yeah, that's what that is. Oh, I remember that too. Boom, 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 boom. It's a lot faster than flashcards. It's a lot more colorful than Quizlet, and it's going to activate a lot more senses. Again, I'm a I cannot say that dang word to save my life. Credentialed teacher, not for nursing. For English, even though I can't speak it to save my life. But by the way, English is one of those hardest languages in the world to learn. So let me tell you what, right now, I have a lot of sympathy. I'd much rather learn Spanish than English, let me tell you right now, because they have it organized. English is a mess. Holy macaroni. How people who learn that as a second language, oh my gosh, y'all are brilliant. I have so much respect for you. You don't even know. So much respect. And some of you can even speak 3 languages or 4 or 5. I mean, seriously, I had a professor who spoke 5. My aunt, I think, speaks 5. I'm like, good grief. Brilliant people, brilliant. I'm not one of those. Sorry. Sorry. But that's okay. All right. Another tip that I want to give you. You're going to notice a big mess here right now because it's been a whole, semester. But tabs. I wouldn't suggest just using these little tabs. Notice I started with these. They don't have any labels on them. It's kind of hard to, you're like, oh yeah, I'm going to tab that. Well, what are we tabbing? We don't really know. When you get a tab, get a Post-it note and write it down on what it is that you want to remember. Like if it's, say fluids and electrolytes, say you're just documenting the chapter, say there's a specific thing you want out of there. Say it's hyperkalemia, so that you can find it, so that you don't go digging for hours through an index or digging. You just don't waste your time. Another tip. This came from an astronaut. Boil it down to a 1-pager, okay? Best advice I have ever gotten in a long time. This one I did on chapter 9. Look how tiny that is. That's called a one-pager. Look, there's not even anything on the back. This helps you. If you can go through your chapter and you can say, I need to know this, 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 and you can list out all the things that you know are absolutely important. And you can put the page number so that you can find them immediately. That is going to save you so much time. Not only that, it's going to consolidate all that information in your mind because 2,000 pages is a lot. Again, I repeat, 2,000 pages is a lot. By the way, when you start Nursing 101, you were not just supposed to be reading just the Taylor book. I know, terrifying, right? There's also the Davis Drug Guide. There's also med-surg chapters. I left some of my other books over there. There's stuff out of a nutrition book. There's stuff out of a leadership book. There's stuff out of Kaplan's The Basics. You're going to be probably getting that if they have you purchase the Kaplan program at your college. I know they do at mine. Read that thing. That thing summarizes things in a beautiful, beautiful way. Specifically for fluids and electrolytes, my God, read that thing. It is going to help you understand fluids and electrolytes beyond all comprehension. Please read that. Just the stuff that works, but just look at it because it's going to bullet point it out great. It's going to be awesome for you. Also, you're going to have a care plan book that you're going to need to be reading. So you're going to be, and dare I forget, Karch. That's also there. Pharmacology. I love that book. But anyways, I had no time to read it over the semester. It was awful. It was awful. Did I need to read it? Yeah, those are probably the questions I missed. If you really want to know, the more that I read, the more I was like, well, had I had read that like I was told, and I'm not kidding, you know, the more you read, the more you know, the more you understand. So, Taylor book, underline, annotate, make notes, okay? Let's open up to one of mine that's, I'm always underlining, you know, a lot of people, they go, oh no, don't write in your book. Listen, like I said, English major, credentialed to teach English, okay? I was taught by my English teachers, okay, who made me who I am today, that you are supposed to do that. If you are not, let me pick this. This book weighs like, I swear it's like 10 pounds. If you are not writing in your book, if you are not starring things and annotating things, my friends, you need to be. I don't care that the book is $2,000. Not $2,000. That's how much it costs for just about everything. $200. Let's hope it never gets to $2,000. Might be 2,000 like, anyways. All right, let me get off the geek train. But it's going to be, you know what? I don't care how expensive the book is. You're not going to resell this book. You want to know why? You're going to need it for the rest of your life. Let me repeat that. You're going to need it for the rest of your life. If you don't think I've already referenced Taylor again, you are wrong. I already have. It is one of those things that it's going to be there for the rest of your life. It's a foundational book. I'm really like big. Don't sell your textbooks. You will live to regret it. One time I threw some of mine out from high school and oh my gosh, I lived to regret it. And I was so fortunate because I found some old textbooks for sale for, you know, cheap that helped fill in the blanks. Okay, Taylor, study and know those skills in advance. Number one. Number two, know that equipment. Know it. Know every single piece of equipment and what it's for. Make sure it doesn't clash with anybody's allergies. For example, again, you might have a latex kit. Someone might be allergic to latex. Look out. You might have some iodine swabs. Someone might be allergic to iodine. Look out. Might need betadine. Okay? So be careful. Those things are really important. Take it from me. I've made these mistakes. A lot of mistakes. Holy macaroni. So like I said, do it yourself too. Oh my gosh, I cannot stress this enough. Get in there, hands-on, and do it yourself. It is so easy to see what other people are doing wrong. My friends and I would all sit there and watch these videos of people doing stuff wrong. We're like, how could they screw that up? And then like, you know, 5 seconds later, well, I know I'm screwing it up. They probably did fine, but I screwed it up. You know what I mean? So doing it is different than watching it and knowing the difference. It's so easy to make mistakes. You also need to remember this. When you're doing all of this, it's a lot. You are tapping into, nursing is not, it is intense, okay? It's intense, warning you now. So just get your mind there now, okay? You need to know a lot of things. Like I said, you got to know all those things that you got to bring to the door. You got to know what you need. You got to know when you need it. But you're also going to need to know how to interact with the patient, how to talk to the patient, how to answer questions, how to communicate, how to look things up in the MAR, the medicine administration record. I believe that is the exact terminology for it. Watch me have to look that back up now. Oh Lord, I'm gonna never hear the end of this. Or the EMAR, that's the electronic one. Okay. And that's where you can see all the medicines and stuff. But by the way, it's very, very helpful. It's very, very cool. You actually get to like roll it around and stuff. So kind of fun. And it helps you make sure that you don't make a mistake and lets you know, but you also need to do your own paper, take your notes, look at everything, just in case that computer's wrong, because you can't always trust a computer. For the record, I trusted a computer the other day and it let me down. Okay, so don't trust a computer. And it wasn't with nursing, it was with something else. It was literally with like banking. And I was like, are you joking? So, is it really that hard? Okay, so I don't know. It's one of those things where make sure that you double check and triple check everything. Also, how could I forget? Dimensional analysis. Know your math. It's very easy. You don't need to know algebra. Everybody just take a deep breath in, breathe out. You're going to have to take a test on it. You can and you will pass. Everybody I know has. You want to know why? They studied and they did a good job and they practiced, okay? You just need to be able to know your conversion factors. Memorize them so that you know how you to get from point A to point B. Start with what you're looking for. If you're looking for something in milliliters, you start in milliliters, okay? That's the most important thing, and I learned that from Professor Parkinson. She's great at math. If you have any questions, go talk to her. If you know who I'm talking about, talk to her. If you're looking for milliliters, you're starting in milliliters and find the thing that makes sense. Is there going to be information in there that's going to confuse you? Yeah, some of it's just outlier information. It's not necessary. Just use the stuff that's necessary that gets you from point A to point B that solves the problem, okay? That might not make a lot of sense right now, but when you start digging around and looking at those math problems, it's going to make a lot of sense, okay? Again, boil it down to a one-pager. If you can't figure out what you need to know, you don't know what you are doing. Trust me, I didn't know what I was doing until I started figuring out how to boil it down to a one-pager, which is why I'm telling you, learn from my mistakes in advance. And if you can do all of this in advance before you even get accepted into nursing school, I advise it. Oh my gosh, I advise it. I want nurses that are prepared. I want nurses that are like, yes, I already know this. I want nurses that are going into nursing school who already know their skills so that they can get to the med surg and the drugs and they're like, okay, now I understand why I need to know heparin. Now I understand how all of that works. Now I know why Coumadin does this, that, and the other. I want you to know that. I want you to have the opportunity to be able to apply that. You're going to get that much farther down the road. You're going to be that much more advanced, okay? And you're going to have a much easier time. Imagine trying to jam all of this information in 5 weeks. It's really intense. The drugs, you're going to need to know the drugs, okay? The endings of the drugs are definitely important, so make sure that you understand that. If they give you a drug, make sure that you learn it. You're going to need to know the side effects. You're going to need to know its peak and its trough. You're going to need to know how it's delivered, okay? Medication administration, very big deal. If you can go ahead and get into there, chapter 29, start looking at it now, do so. Memorize how to administer medication. There's a lot of different ways. I bet you're thinking a shot, right? That was my thought. I was like, yeah, I know how to give shots. No problem. Right? I've had friends that have diabetes. I have animals, I used to want to be a veterinarian. I get it. Like, no problem. No problem. Oh, no, there's a lot more to it than that. You'd be surprised. You will be surprised. I was surprised. So, there's a lot more to it than that. So make sure you know it. When they give you a drug, like I said, you're going to want to know it. You're going to want to know its classification. I'm just going to give you a brief overview. I'm going to go over this in a minute too. Pharmacokinetics, how it's metabolized and excreted. That's important. If you got somebody with kidney failure, you might not want to give them, a renal failure. You might not want to give them something that has to be excreted via the kidneys only. That could be dangerous. That could lead up to toxicity. So you got to think. You got to use those critical thinking skills. Trust me, that's not something I always have. So, you'll learn as you go, like me, but you'll get there. Contraindications. Make sure you're not giving somebody something when they shouldn't be taking it alongside something else. What to look out for, obviously, anaphylactic shock, and the way that it comes. Like, does it come in a tablet form? Does it come in an oral mucosal lozenge form? Does it come as an injection, intramuscular injection? What kind of injection? All these different kinds of things. Nursing implications, how to apply them. Okay. Last little tip that I want to give you. You're going to have to do what are called mini care plans and clinical worksheets. Don't let them scare you. They can actually be quite fun. So you need to know to be able to assess what is going on. What on earth is this patient here for? Okay, make sure you document it. Subjective data, which is coming from the patient's mouth, what they say, and objective data, which is what you have taken, their vital signs, which you have observed, okay? Things like that. Physical assessments, things like that. That might make a little more sense if you study it, like what when you auscultate, that's listening with the stethoscope. Big word for a simple thing, I know. Things like that. You got to know that. Then you have to come up with a NANDA diagnosis. And that's what that big care plan book, which I should have brought over here, is for. And that book's great. And you will actually find them in your Taylor book as well. In fact, I even wrote it down here, like at the very bottom, you'll see. And a diagnosis found on this page. And there you go. That tells you what diagnoses can we use for this specific thing. So, it could be anything. Ineffective airway clearance related to, what's it related to? And then, as evidenced by, how do you know that this is going on? So related to, as evidenced by, big important words. So be able to explain it, okay? And then also explain what you're gonna do. Now, there's different types of interventions. There are active and passive interventions, and independent and collaborative interventions. Which one do you think that your teacher is going to want you to put on there? Well, for the most part, depending on your teacher, they're probably going to want the active interventions and the independent interventions, okay? So let me be very clear on what that is. Active is you doing something, not just sitting there, monitoring something like, oh, I looked at a screen. No. Anybody can do that. They want to see that you actually went in there and did something, okay? So put that down as your intervention. And the time and the date by when it's going to be done. Very specific. You're going to set goals. You're going to meet those goals or not meet those goals. We're going to assess that at the end. It's like a scientific experiment, hopefully for the betterment of the individual that you're working for, okay? Because we always put the patient's health first. Patients before us. If we screw up, be honest about it. Patient before you, always patient first. Side note, but still. Okay, so that would be active versus passive. Now, what do you think independent versus collaborative is? Independent is what can you do on your own as a nurse without a doctor giving you an order. Some teachers don't have a problem with you throwing in collaborative measures. Collaborative measures might be administering a certain type of medication, okay, or working with a respiratory therapist. Well, the medication has to be ordered by the doctor. That's collaborative, okay? The working with a respiratory therapist, they're working together. That's collaborative. What can you do on your own? Did you teach them proper breathing exercises, pursed-lipped breathing, where they're struggling to breathe? That would be an independent, okay? That's independent. You could do that all by yourself. All right. Measuring intake and output. Can you do that? How much went in, how much came out. Independent, you can do that. Some people kind of are on the fence about that, as whether that's active or passive, but I'm sorry, but if you're measuring, that's active in my book. Someone can fight me about that later, but anyways, those are the kinds of things to pay attention to. So you want to know what's going on with the patient. Why is it going on, biologically speaking? Okay, what's happening inside that body that's making it go on? How to fix it. Set a goal, how to fix it. Did you meet that goal? Okay, and then also know your drugs. Know how they're going to affect the body, what shouldn't be mixed with what. And if I sound like I'm heading into med surg, it's because I am. Because you're going to get a huge foundation for med surg. Okay, so hopefully this has been a little bit helpful. Just some tips. I said quick tips, but I don't think this was very quick, but just some tips of the trade that'll help you to understand what is going on and how to survive nursing 101. You can do it. Do not be afraid. You can do it. It's going to feel awkward. It's going to be difficult. You're going to have to tap into so many different learning modalities. It's insane. Do not forget that YouTube is a source. I'm old. I forget. Okay. I'm going to be real. I know I look young, but I'm not. Okay. I forget all the time that YouTube is a really, 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 really helpful source. Sarah at Registered Nurse RN or something like that. I always forget the name. It's on YouTube. Watch it. She's great for everything. Okay. Everything. If you've got a question, look it up from a viable YouTube source. I've heard Simple Nursing is great as well. There's a lot of other ones out there. Our teachers had us watch a lot of different videos. You can watch the Taylor videos. You can actually purchase the whole Taylor package, and then it comes with the videos. So it even comes with sound effects and Picmonics. So if you learn better through Picmonics, good for you. You can use that as well. Do what works for you. And also, if you're struggling with biology, if you haven't taken your T's yet, please go buy ATI testing T's package. It's like $250. It's worth your money. Go crank out some old textbooks, and also watch Crash Course for anatomy, physiology, and chemistry. I got a 91.3% on my T's. I have the utmost respect for all of those sources. They saved my bacon. If you want to do well, go that route. ATI is who makes the test. Go to the source. Same for when you take your NCLEX. Go to the source. If it's Pearson VUE, who's still making the NCLEX by then, get your Pearson VUE review guide, okay? Go to the source. That's how they're going to word the questions. Oh, I almost forgot one thing. One last thing that nobody told us about. See this right here? This is Fundamental to Nursing, 9th edition, The Art and Science of Person-Centered Care by Mary Lee LeBron. And it's a study guide. And I'm going to tell you, I love this study guide. This study guide was great. If you need an ISBN, it is ISBN-13 is 978-1-4963-8254-2. Okay? That study guide, which I got from my friend Letty, is amazing, which, you know, if you watch the other stuff below, you'll hear her. She's brilliant. That thing saved my butt because it asks questions in a way that helps you understand this big, humongous 2,000-page Taylor text. And it really gets into the nitty-gritty. And yeah, it's going to make you go a bit above and beyond. So you might not answer all of the questions, but it's going to help you start to think in that NCLEX question style fashion, in that, I hate to say it, weird way of thinking sometimes, because sometimes our brain is not just geared to think like that. And the way you have to think in order to answer these nursing questions, you got to gear your brain a certain way. Professor Parkinson had said, look at everything as a true or false question when you are reading through your responses. Is this statement true or false? Yes or no? Yes or no? That's how the process of elimination when you're answering the questions for multiple choice, or anything for that matter, or select all that applies, you know. And some stuff you just got to just memorize it to be able to write it out. So be prepared. But yeah, get that study guide. It's an excellent source. It's definitely not advised by the school, but I will tell you that both Letty and I'm sure if she was here right now, she would tell you get that thing. I advise that you guys get that thing. You cannot start studying soon enough for this. I know that that sounds very cliche and very teacher-esque of me, and I'm not saying this as a teacher. I'm saying this as a student nurse. Dear God, start now, because it is a lot of information to cover, and I read very, very slow. I don't know about you. Maybe you read like and retain things like a super genius, but I don't. I'm a very, very slow reader. It stinks, but it's the truth. So read as much as you can now, learn as much as you can now, boil it down. Like I said, you can put it on Twitter, you can tweet it to yourself, and you can just read them through like flashcards. Other people use Quizlet to create little flashcards. That didn't work for me. I needed the visual. I needed a picture. I needed my own words. I needed to see my, I needed that. That helped. So if you're anything like me, hopefully that helps. Don't forget to know all your supplies, to be able to gather all of your supplies by yourself. You are not going to have help. And be able to accurately use all of your supplies while properly talking to your patient, while properly performing hand hygiene and using all proper protocols and procedures and proper PPE as necessary, which is kind of a big deal now that we've got this coronavirus stuff going on, need I say. And again, boil everything down to a one-pager to understand. I hope this has been helpful. Best of luck to all of you. I cannot wait to see you all pass with straight A's. I know you will. If you take my advice and you study really hard, I know you will. You can do it. Don't let anybody tell you you can't. You can. Keep going. Keep learning. You've got this, and I'll see you on the other side.